All right, so we will get started. My name is Ron Reyes. I am one of the advisors here at the Career Center, Associate Director of Development and Industry Engagement is the official title, as well as my main area is pre-health slash health professions. So just a reminder, we will be going over some major topics today to help students kind of navigate planning and preparing for their career here at UCSD as a student, as well as looking at different healthcare professions. Since this session is being recorded, please try and reserve your questions until the end of the presentation, where I'll stop recording and then we can kind of dig into each of the questions that you have. Much of the information will be covered as part of the presentation. So, real quick, we are going to go over a lot today. So please make sure to, take your time to kind of absorb all the information. We will have this recorded, so don't feel like you have to take every single note. But we're trying to get through a lot of information to onboard you with needs to know and helpful things for you to start planning around as you start here at UCSD. So we'll go over introductions. I'll introduce HealthBeat, which is our programming here at the Career Center specific for health professions. We'll go over a quick look at some considerations for healthcare professions and academics, alongside general tips and understandings around experience and any additional considerations for how you go about planning your education and your professional career. Hopefully, we'll have a little bit of time to just wrap up some general resources that are coming up in the year, as well as leave some time for Q&A. So a lot to go over, I know, but let's get through it. So, just to give you an idea, there are two of us that focus here on pre-health advisement under HealthBeat. One of my colleagues, Jade, unfortunately can't be here today, but she will be joining us in October and back from leave. Jade comes to us from the community colleges and previous UC. She has a background in career counseling and advisement, and I'm happy to have her here with us in HealthBeat. I myself, again, Ron Reyes, Associate Director as well. I come from having a background in higher education for about 2 decades now, almost. And within that time, I've had multiple hats from admissions to academic advisement. I've worked alongside nursing programs as well as the post-baccalaureate programs specific to pre-med here at UCSD. I've been with UCSD about 5 years. Before working in HealthBeat, I was within healthcare education, where I worked alongside many previous deans and faculty advisors within healthcare. So I'm very excited to work with all of our students here to hopefully give you some insights, information, and planning around healthcare. So before we get jumping into everything, I just want to remind, not only do you have access to HealthBeat, but HealthBeat is situated within the Career Center. So for all my students that are on the call, if you could put in, what major you are, just so I can see the spread of what we have. I just want to let everybody know, regardless of what major you have, pre-health can exist in any of the different majors. So know that there are advisors here within different areas and specializations and majors that are also your counterparts to help you with things like resume review, with talking about professionalism and strategizing. And they are all housed within the specific areas of study that you already have. So even if you're public health, neuroscience, world lit, literature, there are going to be people here that can help and assist. Now, they might not always have the same level of focus as Jade and I in pre-health, but I just want to make sure you know that you have not just Jade and myself, but the rest of the Career Center helping you with professional development and helping you stay successful here. So I just wanted to give a quick shout out not only to my team, but let you know that each of you have additional advisement access through these specialized advisors that are within the respective areas of study. So, jumping into HealthBeat itself, if you haven't followed us yet on Instagram, please follow us. We do a lot of programming throughout the year. So I want to make sure that all of our students are aware that we post not only opportunities within UC San Diego, but from our different partners across the county, as well as any sort of other educational programs, graduate programs that want to let our students know specifically about things that might be applicable or helpful for them. So it's very easy. You can just follow us, HealthBeat underscore UCSD. And then I'll go over our website, which is healthbeat.ucsu, healthbeat.ucsd.edu. So it should be fine to both use the phone and mobile browser. What you'll find in our HealthBeat website is basically an amalgamation or condensing of all the information that we try and put together based off of the most common professions that students ask us about. So on the screen, we have medicine, dentistry, pharmacy, PA, optometry, PT/OT, veterinary, public health, and nursing. But that's not all that we support. I've had students ask for help when looking at things like genetics counseling, or maybe certain other areas like dietetics and nutrition. So, these are kind of the big ones, but we still do appointments and support with all the other potential healthcare professions that students are looking at getting into. So I just want to give a quick shout out to those kinds of areas that we'll be covering. Out of curiosity, if anybody would like to put in chat the areas that they're interested in with healthcare, please go ahead and do so. So I just kind of get an idea of the spread of what we have here today. But while you do that, I just want to go over what HealthBeat or how HealthBeat works. So again, we are a centralized platform or programming that it helps students explore, okay, what are the difference between healthcare professions? You know, uh, what kind of advisement information that you need, and really we try and serve as a guide to helping you navigate different professions. We do work extensively with a lot of the partners on campus, so you'll see a lot of times we'll coordinate with School of Medicine, Skaggs School of Pharmacy, the new PA program or physician assistant program um, that has just opened up, alongside with public health, which I've also worked extensively with. We do have also academic units that we work with. So a lot of times when we are giving recommendations about general education, course requirements in relation to prerequisites, we are discussing them with both, biology, chemistry, physical science, human development, global health, and the colleges. So we take a very active role in trying to vet as much of the information that you are going to be utilizing through HealthBeat. And then in addition to that, we do work alongside different student health organizations. So HMP3, for example, is one of the ones that I work with, and I help them put together different programming throughout the year for students, such as our large conferences that we have specific to healthcare. So how should you utilize our resources? Well, first and foremost, if you are still trying to get a basic understanding of a specific health profession, there is the Explore section for each of the professions we list, as well as a general Explore section for just health professions on the HealthBeat website. So that is a good place to start. If you're not 100% sure of basic expectations for a specific field, we'll even list the national organizations you should be aware of to understand the field better, general expectations about how to look up the various information you need to know, not only for application, but livelihood of the field. In addition to that, we schedule one-on-one appointments via Handshake. So if you haven't scheduled a Handshake appointment before, it's very straightforward. And we do release additional appointments, typically Fridays at after 4:30 p.m. So if you're going to check for new appointments, check Fridays after 4:30. Usually appointments are 2 to 3 weeks out, sometimes 4 weeks if we're talking, application season and we have a huge amount of people planning to apply. There is also the Career Center YouTube channel. So HealthBeat has a specific playlist on this channel. Please be aware where it is. It is on the Career Center website, but we'll also be sending out reminders and links to the YouTube channel once the recording is available. But that is a great resource and if you miss any programming that is recorded throughout the year that we put on, it'll go on to that playlist so that you at least have access to review it. Besides that, like I mentioned before, we do have workshops and conferences. Two big conferences students should keep an eye out for. This happens every year is Meds Conference and Underrepresented Medicine Conference. So Meds Conference is at School of Medicine, and it is your traditional big undergraduate medical professionals conference that is supported by School of Medicine here at UCSD. I work with our student organization at HMP3 and School of Medicine to put that on. Similarly, with the same group, we do underrepresented in medicine, which is in usually housed in SCAG School of Pharmacy. That is spring quarter. And with that one, we try and take a more diversified approach, not only to medicine, but looking at different populations and opportunities that students should be aware of when approaching a more kind of cultural and a multi-contextual understanding of healthcare. So that happens every spring quarter. In addition to those, I always say, keep an eye out for the year-round programming that we do. So there are going to be different workshops such as personal statement, experiential writing, resume and cover letter for healthcare professions, application workshop. These are different titles of things that we have done in the past that we usually will provide for students throughout the year for you to participate in. Again, if we run it, it'll try and get recorded so that you have access to it later should you miss it. Besides that, we do provide some educational programming through FMPH 95 MedPrep 101. This is a one-unit course. It's semester-based, and really it's designed for the students who need additional help just getting organized for healthcare professions. It is open to basically first year, second year students and transfer students. The idea is hopefully it gives students the opportunity to work towards making sure this is what they want to do. Healthcare is very demanding, so we try and give a lot of different ways to kind of approach, understand, and consider what am I doing? Is it worth my time? If it is worth my time, how do I go about planning and looking at the professions? Again, it is one unit course. We only to ask for about 50 minutes of your day, so hopefully it shouldn't be too bad. But really, it is designed as a tool for students to navigate. So, besides that, the last thing I will mention is that we do have quarterly drop-in week. So, quarterly drop-in week is basically scheduled around week 4, which is traditionally when there is the drop deadlines for courses. The reason we do this is because a lot of times, if students are going to make changes to their classes, you are going to do drop-in hours for financial aid. You're going to drop in hours for academic advisement. So we try and time our drop-in week around the same time that you would be doing drop-ins anyways for these other departments so that we can talk about, okay, now that you've talked to academics and financial aid about possibly changing what you are doing this quarter, you can have the time to check in with us and talk about, how this might affect your planning or long-term planning for healthcare professions. So we usually time drop-in week around the same time as when most students would be trying to do drop-in hours for the other departments. So I do want to put that out there for students to be very aware of. And again, we will put reminders about this on Instagram when they happen each quarter. So now that you have a basic understanding of the you know, basic resources that HealthBeat provides, we will now go into talking about professions and academic considerations. So this is just a quick breakdown of some of the most talked about or asked about professions that we come across within our advisement. So you'll see the usual suspects: medicine, PA, nursing, dentistry, pharmacy, physical therapy. Um, all of these are common professions that we talk about. Whoops, sorry about that. Something that we try and make sure students take into consideration for long-term planning is not only just your academics, but also the different types of requirements and expectations behind each of these fields. For example, medicine is the longest route, right? If we're looking at 4 years of schooling, 50% didactic, which is lecture, 50% clinical, which is clinical rotation, and then additional 3 to 7 years of residency, which is additional training and focus within the field, followed by testing. That's a long path. That is literally 7 to 10 years worth of education many times, sometimes 11. My MD, PhD people are going to have a very long route with their career, right? So there's a lot to take into consideration with a lot of these fields. Even the fields that people think traditionally take shorter amounts of time, like PA and nursing, do have additional expectations around either time leading up to application or afterwards that might affect your overall planning. So regardless of the field that you look at, we want to make sure that you are thinking about the amount of time that is going to be invested in each of these programs, as well as any additional considerations, like how much am I going to pay for this over the period of time that I'm doing this education? Am I going to be maintaining an academic level that I'm comfortable with in order to you know, be hopefully a competitive or reasonable candidate for the different professions I'm looking at. So these are all considerations that we have when we're talking about planning for healthcare as a profession. You have to plan for application, which is usually years in the making. So, common question I hear: what major do I choose? Does anyone in chat want to take a stab of what we would probably say? I see any major, any major, any major. Yes. So use a major that interests you first, right? Regardless of where you go and what you do, if this is something that you're interested in studying, hopefully you're going to perform well in it. Regardless of the school that you look at, they do want to know that you can perform well in something that you like first and foremost. So major does not dictate profession. I'll say that again. Major does not dictate profession for those who are curious. But sometimes students do also consider, are minors necessary? Maybe if you are interested in that area or it provides access to course content that you don't normally get access to that you would like to take courses in, then that's fine. But I always say whatever you choose, do well. That is the first and foremost. Again, whatever you choose, do well. So even for my non-science majors, do I have any non-science majors in the house? I believe so. I think I saw literature there. Um, you can still get a lot of these courses done if you have elective or open space in your planning. If you don't have additional space to get a lot of these prerequisites that we'll be looking at, that's still okay. There are ways to get that done either at the community college or maybe that's when we might want to consider a minor, right? You have a lot of different options. Just understand, depending on the profession that you are looking at, that you might have to do some additional planning to get to the courses. So while we're talking about courses, I'm going to just quickly go over basic AP policy and planning. So AP credit, IB credit planning, excuse me. So what you get in to count for your degree depends on your degree audit and what you have access to. So always, always, always double check. I believe in Triton Link. If you go to your unofficial transcript or degree audit, you should be able to see how they were applied. If you've gotten EP credit already, you cannot take the exact same course in which you got EP credit again without significant financial repercussions, as well as it not showing up on your academic record and its approval process. So usually in advisement, our best recommendation is first double check if you are going to take additional courses outside of what you receive for AP credit that rely on the courses that you have taken. Other than that, I would say that depending on your healthcare profession, there are other ways to show proficiency without having to redo these courses. So we do list as well detailed AP policy information on the HealthBeat website. So you can also drill down on that information as well. So again, do I need to redo AP credit? It depends. Some professions and some courses possibly. Again, I would avoid it if at all possible. You might be able to take upper divisions or advanced coursework instead and still fulfill that area of expectation. IB credit or International Baccalaureate credit can be a little bit more challenging because we don't see that as much on No, some admissions committees as it counting. So sometimes they'll make recommendations of, again, utilizing either community college courses or upper divisions to fulfill that requirement rather than retaking it at UCSD. So either way, you always want to review, okay, what is coming in on transfer and are there other opportunities before absolutely needing to retake the course, because many times there will be other ways to get this course content completed. So, with that in mind, here is some sample breakdowns of course content. So, we're looking here on the left at medical requirements. I'm pretty sure a lot of students have seen this before. This is a sample, all right? I say that because, for example, calculus, statistics, physics, sometimes people will have gotten it done elsewhere or in different course titles, and it will still be fine. When I say 1 year, usually it means 1 year of an area of study that is traditionally looked at for medical school. So 1 year of biology is a year's worth of general biology with lab coursework completed. Same for chemistry, same for organic chem. For math, it's a little tricky. So usually we're looking at a couple calculus courses and a statistics course mixed and matched in. This is also an area that a lot of schools might have some flexibility on their admissions policy when they post it on their website. So I just say keep that in mind. About a year's worth of math is usually a couple calculus courses and a statistics course. Physics for UCSD is interesting. If it's the one series, usually it's like one AL, uh, AAL, BL, CCL, and then it actually got kind of reduced, kind of funny on here, but basically it's about 3/4 worth of, or 3 classes worth of lecture plus the appropriate lab if you're doing a one or or 1 or 2 series physics. Again, detailed versions of this are on HealthBeat. And then biochemistry, that's a small number of biochemistry courses that count, but there's other ones that can count as well. So again, this is a general sample to give you an idea of what we typically look at, using medicine as an example. On the right, interesting thing. So we have other courses that are usually considered recommended for medicine, but may be required for some of my other professions. I saw on there some people put things like nursing or PA. So for nursing, PA, DPT, for example, physiology, anatomy, and microbiome are essential. So for physiology, you know, be prepared. You're going to need to take that for a lot of these professions. Medicine, they have a little bit more wiggle room with that, so it's highly recommended. But for those students in the profession that specifically call out courses like physiology, anatomy, and micro, those are kind of become top priority for you instead. So, with that in mind, some quick considerations for my students that are going to utilize those classes, just as a quick heads up. Physiology and micro here are upper divisions. If they were the community college, they would be lower division, therefore easier to get access to. But for people who have to take these courses, just understand that there are additional expectations and requirements. So for example, physiology, if you do need to take the lab is massive here at UCSD. So be careful. It is 6 quarter units for the BIPIN 105 physiology lab. Microbio here as an upper division requires you to get through organic chemistry as well as I believe, molecular in order to do the microbio lecture. Okay, so that can be a little bit of a process for students to get to microbio here. Since main campus doesn't teach anatomy, UCSD Extension does, which Extension I like to say is the community college equivalent or community-based education that the UC does provide, but Extension is its own separate department. So UCSD Extension does provide an approved anatomy course, which is Build X13 anatomy. That's available in the summer only. If you are taking an extension course, I'll say this right now, they do have a financial aid link within their financial area. If you're a UCSD student, you can apply for $500 off any extension course as a UCSD student. So keep an eye out for that. We can always go over more of that information later. And then as far as course load at UCSD, a lot of students we'll be starting off maybe with 12 units, sometimes 16. Hopefully, you're not taking a very aggressive course load for your first quarter here, because it is a transition to do a lot of these courses within 10 weeks, right? So you want to just think about making sure that whatever classes you are taking, start strong and do as best as you can. If you are struggling and need to go down to a slightly lower course load, hopefully you're still maintaining what is considered full-time status, which is again about 12 quarter units per quarter. In general, there's no judgment if students take slightly lighter course loads, as long as it's understandable why. Are you doing well in your classes? Are there other things that you're a part of or that potentially make sense? Oftentimes we'll have students ask us, well, if I go down to 12 quarter units, does that mean they'll look at me differently? Probably not. Again, as long as you're performing well. So those are just some quick reminders. Next, we're going to talk about gap years since it's important when taking into consider academics as well as experiences. Can anyone in chat let me know what their definition of a gap year? I'm just curious if anybody would like to give their version of gap year. I'll give a minute for that. Anyone, any takers? All right, guess not. That's okay. So oh, there they are. So taking a year off in order to pursue other passions, taking a break, uh, building information for medical school, those are all valued. So gap year is really just time spent between graduation from college and matriculation into medical school. So no gap year would look like somebody submitting their application to medical school junior year and or end of junior year, excuse me. And so during the entire senior year, they're going through the process of putting their paperwork in for review and evaluation, getting interviewed. Towards the end of the year, they are getting hopefully an acceptance so that after they graduate, they would then immediately start that upcoming fall at a medical school. If someone is taking an additional gap year, like just one gap year, for example, maybe they are applying at the end of their senior year. And so during the time in which they are not working, they're just working and focusing on, or excuse me, not in school, they're just working on focusing on the application and the application process before matriculating into medical school. Either of them is fine, perfectly valid, whether it's no gap year or gap year. Students have done both. I will say, statistically speaking, pre-pandemic, over 65% of, excuse me, over 64% or around 65% of applicants that were successful for medical school took one or more gap years, up to 5 gap years, actually, if we're talking about data. So up to 1 to 5 gap years to be successful, 65%. So that what that tells me is only 35% of successful applicants had no gap. So if it's right for you, you'll know based off of having everything you need before clicking submit. Because the one thing I have to tell everybody is, medical schools are not going to look at whether or not you have a gap year as much as are you prepared by the time you click submit? What have you been able to provide to us, both academically, experientially, written material, letters of recommendation, MCAT score? What does all of this say about you to say that you are now ready for the next portion of your academic career and tackling the profession? So always keep that in the back of your head when we're talking timing, pacing, and planning. So another question that I get often from students, especially for those who might not have a ideal combination of major and college for purposes of these prerequisites we went over, can I take community college courses? Absolutely. I have on record, video recorded, the dean of admissions from UCSD School of Medicine saying that there is no problem with community college courses. I will say, as a full-time student at UCSD, typically if students are taking community college courses, it's usually over the summer if they want to do that. There are some additional considerations, however. If taking these courses, still do well, right? But more importantly, making sure that if these courses are part of prerequisites that you need to get access to either additional courses in your major or additional science courses, you have a conversation with academics and academic advisement to make sure that you are not delaying access to other courses. The other thing that I will say about especially prerequisites, usually it's hard to transfer from quarter system to semester system and sometimes semester system to quarter system because there might be some loss of information in how these courses are taught if you only do part of a academic sequence, an academic sequence being again like year of bio, year of chem, etc. So you want to make sure that you are having these conversations with academics to see if it might be more work if you are not doing a full sequence at an institution. So those are main areas I would take into consideration. The other thing I would say, if it's an online course and it is for a science, it's going to be very debatable whether or not that might be allowed. So be careful. Again, our default answer will always be anything outside of normal scheduling should be checked by not only academics, but also in comparison to both the profession and the admissions policy of the schools that you're applying to if we're talking about exceptions to the rule. So those are areas that we always have to mention when it comes to scheduling and especially take courses outside of the UC, regardless where you take them. So now that we've gone over academics, let's move on to talking about your experiences and building experience. Right away, I'm going to jump into the two most commonly talked about subjects that students always ask us about, which is service versus clinical experience. There are differences. Sometimes these things can be the same, sometimes these things can be different. So the first thing that I will say when talking about service experience to be service is specifically, am I being of service to somebody to hopefully make an impact on either a underserved community, or a group that has either been historically marginalized or at some sort of socioeconomic or cultural disadvantage. Those are usually the things that I look at to count something like volunteer work as service work. And so, for example, we have some organizations listed on the left here, like Mustard Seed Project, Educational Horror, and Homeless Heal, as different types of service oriented uh, activities or student organizations. Now, that doesn't mean that uh, there are no service experiences that could be clinical. It's just that there are differences. So, not all service experiences are clinical, not all clinical experiences are services, but there can be overlap. Before I dig into clinical experience, though, I like to check, can anyone here tell me what they think is the most important aspect when talking about clinical experience? You can just put it in chat. Do we have any takers? I see research. Try again. Patient contact, pretty close. So, clinical experience is direct patient care for purposes of admissions. If we're talking, I'm an admissions officer or admissions reviewer, and I'm looking for what is specifically defined as clinical experience, admissions is going to say clinical experience is direct patient care. And then they go further to further define direct patient care. What does that look like for purposes of being clinical? So I'm going to give you kind of an amalgamation of what talking to different admissions teams, how they define and look at clinical experience. And then we're going to talk about how these aspects of clinical experience can be interpreted or utilized to gauge how likely are the experiences that you are getting count towards clinical experience. Okay, so follow along with me. Clinical experience is direct patient care or working directly with patients alongside healthcare providers such as, CNAs, EMTs, phlebotomists, PAs, nurses, doctors, physical therapists, right? So, alongside other healthcare professionals within a healthcare or clinical setting, providing healthcare education or treatment that directly contributes to healthcare outcomes, right? So, direct patient care alongside healthcare professionals within a healthcare or clinical setting that provide treatment and education and contribute to that patient's healthcare outcomes. So, understanding all of that, the experiences that I list here, EMT, CNA, phlebotomy, medical scribe, medical assistant, these are all different ways in which people get close to that full definition. They're not always 100%, but neither is how admissions works. We are looking at, can we see based off of your experiences that you get close to that or as close as possible to that definition, or that you have a combination of experiences that let us comfortably understand that you have had enough healthcare experience with patients that it will apply. Okay, so I put that out there because I think people have a very uh, unclear understanding of what admissions is looking for to truly define clinical experience. Along that line, shadowing is not considered clinical, right? And that is because it is passive. Yes, you are in a healthcare setting. Yes, you uh, are with a healthcare professional, but you are not interacting directly with the patient. You're not providing any treatment or education, and you are not contributing to their healthcare outcomes, right? Only two out of those five things I mentioned are even remotely being covered. So, because of that, I'm very thoughtful, or would encourage people to be very thoughtful about how we approach these experiences and communicate about them. Because what you communicate about your experiences will also determine how, a reviewer can understand whether or not this is getting at least close to a clinical experience. That being said, I always encourage my students, please get involved with student organizations. There are multiple types of organizations on campus that do try and focus on creating healthcare experiences, whether it's volunteer, whether it's over across the border or international opportunities. There are different groups on campus that already try and do this. So, for some examples, EMS at UCSD is mainly for those with already an EMT license. Flying Samaritans, also called Flying Sams, does their own kind of form of community clinical work. International Health Collective, Global Health Bridges, these are all groups that try and find ways for students to interact and get some level of clinical experience. Now, to somebody's point about putting research there, now we understand clinical experience. I'm going to now define research, because you'll see clinical research. If you see clinical research on a position, more often than not, it's research experience, not clinical experience, for purposes of admissions. The reason why it says clinical research is because clinical research is saying we are doing research from the context of clinicians, but not necessarily as a clinician or as somebody who is providing clinical services. All right. So, more often than not, we are going to see research be research more so than clinical work, period, in admissions. So, I just want to put that there for people to understand. Research is not direct patient care. As far as the considerations for research, it's not a requirement to apply to medical schools by and large, unless we are talking MD PhD students. MD PhD students, be prepared to have enough research under your belt that you can have a 10,000 character essay about why you're doing research, research is important to you, and how is this contributing to your understanding and planning to be an MD PhD applicant. Outside of that, research is really should only be for your personal benefit if you decide to do it. Because again, it is not a determinant whether or not somebody is getting into medical school more often than not. And that is because, again, they are looking at, are you okay being a clinician more so than are you being okay being a researcher, right? If you're trying to be a researcher, MD, PhD, or PhD route. But for everybody else, the main focus should be clinical work. So that being said, why do research then? Well, because it has a lot of benefits. So for students who want more exposure to science, a good opportunity to network within sites and locations that could be beneficial for them, right? Because some of these clinical research places are facilities that you would like to have some connection to, alongside mentors who are researchers, right? So our principal investigators are people who could potentially be your letter writers once you do apply to medical schools. So research can be helpful, it is not required. And if it's something that you are truly interested in, hopefully you are going to utilize it to the best of your advantage for purposes of personal development as well as when you do apply. But I do want to make a clear distinction of how we see research from an admissions context for students. Okay. So with all of this being said, we've gone over academics, we've gone over experiences lightly. This all leads to my next thing, which is letters of recommendation, mentorship, and networking. So I want students to start thinking about, as you are here in UCSD, you will always need, for purposes of experiences and application to these different professions, letters of recommendation, i.e., professionals willing to vouch for you not only about your skills, but who you are as a person and why you are either a great fit for a place you are applying or a great fit for a profession you plan to get into. Okay. So, with that being said, you have other resources here to help you with that. Utilize coffee or dine with a professor. That's the university literally paying for your coffee or maybe lunch so that you have a captive audience of a professor who's agreed to talk to you for maybe 30 minutes. That's awesome. There are other areas that you can also further your relationship with these faculty. Show up to their office hours, ask good questions, let them know you're interested in what they're doing, and let them know what your plans are with healthcare professions. Find out what research opportunities maybe these faculty members you want to work with have, because that's again another way to get to know them. I was a instructional aide when I was in IUC, and I developed a really good mentorship with the teacher that I was an instructional aide for one of the intro classes that I was an aide for. So you bet that instructor was willing to write a letter of recommendation for me. Similarly, if you're in classes and you notice there's a class you need to take or could take for a requirement that happens to have a smaller class size, maybe that smaller class size means that you have a higher probability of being able to show up to an office hour or after class and talk to the instructor because there are less people in that class taking up their attention. The other thing that we sometimes see for students looking at developing relationships with instructors is taking more than one class with the same instructor, and letting them know that you really value how they teach, what they do, and seeing if that can help further the relationship so that hopefully they are interested in either mentoring you or providing a letter of recommendation. And then lastly, please look again at looking at affinity groups or different organizations on campus. All of our organizations on campus have to have an advisor, right? And those advisors are people there that are mentors and there to support the programming and ability for these student organizations to be successful. So if you're part of these groups, that is another resource that you have access to. But you have to show up and do the work. So these are just different ways that I want to start kind of making sure that you're aware of how to utilize these resources and ways to integrate yourself into UCSD so that you're a better prepared student, applicant, and overall future healthcare professional. So, what do I do starting out? Very straightforward. Start creating a plan for yourself. Know what classes you need to take based off the profession that you're getting into. Look at the different student organizations to see if that might help you out either with experiences or networking or just having other people like you who are looking at a healthcare profession. Again, we have over 500 student orgs. I think it's at 600 now. And somewhere between like 10 to 16 of them at any given point are healthcare related at UCSD. So that is a great opportunity. Uh, Follow us again on Instagram. That way you don't miss out on any of the events that we put on, as well as the events that our partners and industry partners and clinicians make available to students. We will post those for you guys. We'll also put reminders when these recordings are available online. And then besides that, please start looking and thinking about summer opportunities once you get a handle on this quarter. So fall quarter, focus on academics for sure, right? Know what's around, but I wouldn't start thinking about what to do in the summer until maybe early winter quarter, just to give yourself time to get acclimated. And at that point, you absolutely start looking at what are different healthcare opportunities, service experience, research experience. Those are all helpful things you could start looking at. And then ultimately, if you're a healthcare professional, I'm going to hammer this in every time we work with students on this. Know your why. So know why you're doing this, get experience so that you can ask yourself, is this what I really want to do? Am I okay with how the healthcare system is, or want to be an active participant within healthcare? And if so, understanding your why is going to help keep you motivated to stay with the field. Okay. And then, of course, healthcare changes often. As advisors, we have to constantly be looking at updates and changes. The same goes for students. Healthcare is an ongoing, always developing thing. So make sure that you are a student of healthcare as well. Understand the profession you're looking into. Look at different upcoming topics within healthcare. That further helps and reinforces your understanding, both as a profession, but as a future professional, help you get there. And then lastly, you can please focus on academics to get started, know your resources, get tutoring support through the Learning Commons if you need it, and know that there are ways to get help here at UCSC. You have a huge amount of resources. So again, focus on academics first, familiarize yourself with resources, create a timeline, right? Create a timeline for yourself. Hopefully during that time you are going to put something in there for your own mental health, but like take care of yourself. And then know this is a marathon, right? Healthcare is a marathon. It's not a quick sprint. This is a planning of over several years where you are taking the time to adjust and pace yourself throughout the entire process to make sure that you can make it to click submit. And then from there, you go into the professional training and you do that and you get all the way to into licensure, and then you are a practicing healthcare professional. So it is a very long road. And I want to make sure people are pacing themselves. And then lastly, of course, continue to network and build relationships, find mentors. That is imperative for a healthcare professional to develop these skills, because you're going to need it the entire way through, from undergrad to your professional training to once you are in the field. These are valuable skills you need to maintain. So with that, I'm just going to go some quick reminders. We have the career fair coming up. Again, good opportunity to network with healthcare professionals that are hiring for part-time work. All majors fair is a good place to start looking for that, sometimes also in science and tech. Graduate and professional schools, that includes healthcare professions. So please keep an eye out for that. I've invited several schools to attend that, and I will be continuing to invite them. So check regularly, even up until the day of. There might be new sessions for students to sign up for. So please, 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 please check this out. It's a valuable resource that you guys get all the time. UCSC is one of the few places where you get a lot of fairs that actually are intended to give you more exposure to professional opportunities. We're one of the top in the UC system for that. Besides that, just another reminder, might not be applicable to you just yet, but we have a personal statement workshop coming up in November. I teach FMPH 95 with Jade winter and spring. I will be making an appearance for the GBM for HMP3 since I am their advisor. And then drop-in advisement is always week 4 of the quarter, and we put reminders on Instagram for you to sign up and handshake for that. So lastly, but not least, if you are not sure where to go to find some alumni just to talk to, or other people in professions, Triton's Connect is a great uh, ecosystem for you to be a part of, right? It is a professional ecosystem similar to LinkedIn, where it is only UCSD students, faculty, staff, and alumni. So if you are looking for striking a conversation with somebody who maybe studied the same major as you, or got into a profession you're interested in, this is an easy resource for you to utilize to start that conversation. And if they're on here and they're online, it'll tell you that they're online, and usually it means that they're open to talking. So it's a great opportunity for students. That being said, I am going to stop the presentation and stop the recording, and then we can